Hey, you know that feeling when your doctor suggests a CT scan? Maybe for a persistent cough or after a minor car accident?
Oh, yeah,
It's one of those things that's become pretty routine in modern medicine.
it really has. I mean, think about it. It's a quick way to get these incredibly detailed images of, well, what's going on inside.
Exactly.
It's a fantastic tool. Helps doctors diagnose all sorts of things.
Absolutely. And that's why a new study that popped up in JAMA Internal Medicine just this week, April 14th, 2025, it really made me stop and think.
Hmm.
It's looking at CT scans done in just 1 year, 2023, and, well, projecting how many future cancer diagnoses might actually be linked to the radiation from those scans.
Right. And for you listening, the point of this deep dive is to really get our heads around what these numbers mean.
Mhm.
Why is this study significant?
Yeah.
And how do we make sense of it all without getting sort of unnecessarily worried? We want to break down the science and the implications in a way that's straightforward.
Easy to digest.
Exactly. Easy to digest. Tackling any questions you might have head on.
Because when you hear radiation and cancer in the same sentence, it's totally normal to have questions swirling around.
Of course.
And when you realize just how many CT scans are done every single year, in the US, we're talking around 93 million scans.
Wow.
On about 62 million people annually, you start to see the scale of this. It's a huge part of our healthcare landscape.
It truly is. So let's get right to the heart of this study then. What did the researchers actually find? What are the projections?
Well, their analysis, it led them to estimate that over the lifetimes of the people who had CT exams back in 2023, about 103,000 cancers could potentially be linked to that radiation exposure.
Okay, 103,000. That's a pretty substantial number to wrap your head around.
It really is.
And it's important to remember, like you said, this is a projection. It's based on the information we have now about the long-term effects of, low doses of radiation.
Right.
But the study doesn't stop there, does it? It also looks at the bigger picture, the potential long-term consequences if things just continue as they are.
Exactly. The study authors actually stated that if we keep going at this rate, um, cancers linked to CT scans could eventually make up about 5% of all new cancer diagnoses each year.
5%.
5%, that really puts the potential future impact into perspective, doesn't it? It's not an insignificant portion. What do you think that might mean down the line?
Well, that's a really important question. I mean, if we're looking at a potential increase of that magnitude in cancer diagnoses, it could certainly have implications for our healthcare systems,
Sure.
potentially increasing the demand for cancer treatment and care. And on an individual level, well, obviously it means more people and families could be affected by cancer.
Right.
And on a broader scale, it might even influence how we think about preventative health strategies in the future.
That makes total sense. So who is potentially more at risk here? The study looked at different age groups, which seems like a really important detail.
It is very important. They found that the estimated risk of developing a radiation-induced cancer from a CT scan is actually higher for children and adolescents.
Okay, why is that?
Well, partly because their cells are still dividing more rapidly, making them potentially more susceptible to radiation's effects. However, and this is a really key point because adults are just, well, more likely to have CT scans.
Right, the sheer volume.
Exactly. The sheer volume means adults actually account for a larger overall number of the projected cancer cases in the study.
Ah, okay.
So while an individual child might have a higher risk from one scan compared to an adult having the same scan, the volume of CTs in adults means more adult cancers are projected overall.
That's a really crucial distinction. Yeah, it's not just about how sensitive someone is, but also about how often they're exposed.
Precisely.
And the study also looked into which types of CT scans were most associated with these projections, right?
Yes, they did. For adults, the CT scans of the abdomen and pelvis were linked to the highest number of projected cancers.
Okay. Abdomen and pelvis.
Yep, with chest CT scans coming in second. Makes sense when you think about how frequently those areas are scanned for various reasons.
Definitely. I mean, if someone's having stomach issues or chest pain, those are often the first places doctors want to look.
Right.
And what were the most common types of cancers they projected overall? Across the board.
The study indicated that lung cancer, colon cancer, leukemia, and bladder cancer were the most common overall.
Okay.
And for female patients specifically, breast cancer was the second most common. That's something many women listening might find particularly relevant.
It is a significant point, yeah, and it really highlights the need for careful consideration, especially, for younger women who might have multiple CT scans over their lifetime. But we also can't forget why we're doing these scans in the first place. They're not just happening randomly, are they?
No, absolutely not. And the editor's note that accompanied the study really underscored this point. They stated that CT scans are inextricably woven into the fabric of modern medicine.
That's strong phrasing.
It is strong phrasing.
It is. They pointed out that CT scans are fast, they give incredibly detailed images, patients generally tolerate them well, and compared to some other advanced imaging that can be relatively affordable, which all contributes to why they're used so widely.
Right. All good reasons.
They're absolutely essential for quickly and accurately diagnosing serious conditions, from life-threatening injuries in the ER to finding and tracking cancer.
No question.
So it's a real balancing act we're discussing here, weighing these significant diagnostic benefits against the potential long-term risks.
And that's where the editor's note brings in this really important idea, a wake-up call.
Yeah, I saw that.
They suggest that these new projections should prompt us to think about the risks associated with CT scanning in a similar way that we consider other established cancer risk factors.
Like what?
Like drinking too much alcohol or being overweight.
Wow, okay. Putting it on that level.
Exactly. That really changes how we might view this issue, doesn't it?
Yeah.
It moves it from a theoretical concern to something with potentially significant public health implications.
It does. It definitely makes you think about it differently. And thankfully, the editor's note also offered some potential ways we could, reduce these risks.
That's right. They pointed to a few key strategies. One was looking more closely at using other types of imaging that don't involve radiation when they're appropriate.
That makes sense. I mean, if there's another way to get the information needed without the radiation exposure, that would be ideal, wouldn't it?
Precisely. There are other imaging technologies available for certain situations, and exploring when those might be the better option is definitely something to consider.
Okay. What else?
Another suggestion was to actively work on lowering the radiation doses used during CT scans themselves.
Ah, right. Technology.
Yeah, I know medical technology is always advancing, so hopefully there are ways to get the same quality of images with less radiation.
You'd hope so, and I'm sure researchers are constantly working on that. And the third thing they mentioned was the importance of educating doctors about avoiding what they called low-value testing. What exactly does that mean in this context? Low-value testing.
Well, think of it this way. A low-value CT scan might be a scan ordered for, say, a very general complaint, where the likelihood of finding anything significant is really low.
Okay.
And where the results probably wouldn't change how the doctor would treat the patient anyway.
Gotcha.
Or maybe there are less radiation-intensive tests that could provide similar information. It's about making sure that every CT scan ordered has a clear and compelling medical reason behind it.
That makes perfect sense. If the scan isn't really going to give any new or useful information, then avoiding it altogether seems like the best approach.
Right.
And this isn't like a brand new concern either, is it? I feel like I've heard whispers about this before.
You're right. You probably have. The article actually referenced a 2015 investigation by Consumer Reports
Oh, yeah.
that suggested a significant number, maybe up to 1/3 of CT scans performed, might have been unnecessary.
1/3. Wow, that was back in 2015.
Yep, nearly a decade ago. And it really highlights that this concern about the appropriate use of CT scans, it's been ongoing for quite some time. This new study really just reinforces those earlier findings and underscores the continued need to address this.
It definitely does. It sounds like while we've been aware of this issue, this new research gives us some hard numbers to really think about.
Concrete numbers, yeah.
So bringing it all together, what's the main thing you think someone listening should take away from our discussion today?
For me, the key message is this. CT scans are an incredibly powerful and often life-saving medical tool. Let's not forget that.
Absolutely.
However, this new study provides a really clear estimate of a potential long-term risk associated with their use, specifically due to radiation exposure. It's about understanding that there's a balance.
Yeah.
A balance to be struck between the very real and immediate benefits that CT scans offer in diagnosis and the potential for harm down the line.
I agree completely. And it's so important to emphasize that this isn't about panicking or being afraid of getting a necessary scan.
Not at all.
What it should do is encourage all of us, both patients and healthcare providers, to have informed conversations about whether a CT scan is truly the right next step. And if there are other suitable options that might involve less or no radiation, it's about being proactive and making thoughtful decisions about our health.
Exactly. Which brings me to a final thought, maybe something for you listening to ponder. considering how common medical imaging has become in our healthcare.
So common.
What role do you, as an individual, feel you can play in ensuring it's used responsibly?
Right.
Or perhaps another way to look at it is, with medical technology constantly evolving, how might future innovations further refine that delicate balance between the incredible diagnostic power of tools like CT scans and any potential risks, like this radiation exposure?
That's a great question. Definitely something worth thinking about long after this deep dive.